right. Thank you, Sven. Do you guys see my screen?
Yeah, we can see it.
Okay, perfect. All right. Good afternoon, everyone. My name is Nada Al Garib. I'm the Digital Solutions Manager in ISD, County of Santa Cruz. So I was fortunate enough last year to join cohort 2 of the Results Count program. It's led by the Annie Casey Foundation, and the whole purpose of the program is to make real impact on the community through advancing equity oriented objectives for the county. So throughout the program, we were introduced to many tools that can help our work. One of the tools that I really liked is the PDSA. So what's PDSA? PDSA is a tool for, this is here a kind of a broad overview of what is it. Mainly it's for incremental, for making small improvements toward the goal. So for the first, before we start using this tool, there is 3 simple questions that you need to answer. Is like, what improvements are you trying to make? What are here? What are we trying to accomplish? How we know that the change is an improvement, and selecting like the change that you'd like to focus on, that you believe will lead to the improvement. So PDSA is, it's abbreviation for Plan, Do, Study, Act. The PDSA cycle is a step-by-step way to improve ideas, to improve like a result, and it helps teams to try things on a small scale. So it's incremental improvements. Improve a little bit, learn from what happens, and keep building on that progress for bigger and lasting change. So why do we use PDSA? It's low risk since it's small incremental improvements. We're not waiting for the big reveal. We go step by step. It's data driven. You get quick feedback. It builds team confidence because they can see results right away. And it has, flexible improvement because we're always learning from the steps we take. If we start to just go step by step, the first phase is the plan. For planning, in this phase we identify what we're going to test. We predict what we expect to happen. We prepare to collect the data. And this is, in this step is where clarity and precision matters most. So this will be like the complete planning phase. In the do phase, we start implementing the plan in a small scale. Implementing it means like testing the idea, observing what happens, and starting to gather data and feedback based on the testing or the little improvement or change that we carried out. On the study phase, we look at the results from our test based on the data. We compare what happened after we did the test with what we expected before we started. and we learn what worked and what didn't work. On the final phase is the acting phase. This is where we decide what to do next based on our result. If that change worked like we expected, we can keep it. If it needs fixing, we can adjust it. If the data showed that it didn't help, whatever change we selected to do, hoping that it will improve the outcome or the process, and it didn't help based on the data, we can just, drop it, abandon it, and try another thing. So before we start with the PDSA tool, there is like some prep work. First, we define the target population, like who are we trying to help? Which area, which population? It might be the customers, it might be the public, the community. We clarify what's the desired result. Like, okay, what are we hoping to achieve? We do a factor analysis, which we probably, if you attended previous sessions, you're probably familiar with that, but I'll get into an example about factor analysis. And basically, it's like what's helping to achieve the results, what's hindering the results. And we pick one key factor that we believe is hindering the success or the desired result. And then we select this factor to do small tests of change. I'm gonna dive now into one example throughout the program. When I attended it last year, my goal was to it's all about digital equity. I work in ISD. Digital equity is important to me. So my project was focusing on expanding affordable internet options. As you know, in today's world, fast and reliable internet access is essential for daily functions. It's critical for accessing employment, opportunities, education, healthcare services. Most things are online nowadays, and for connectivity to the world. But I believe that affordable internet connectivity is equally important because without it, low-income residents will be impacted the most. So based on all of that, I had some data from previous programs, and I decided that my focus population will be the household residents who are in area code 95062. What I was, my overall goal is that eligible residents in this area can have access to affordable internet connectivity. So I'm gonna go to the next slide where it shows kind of the how the focus population, how does it work? If you look, this is again kind of the incremental improvement. If we look at the county, like your goal be, okay, I want to help the whole county. You have here, it's the all county of Santa Cruz households. For who's eligible, it's low income households. And then to carry out your test, you need to focus your population to be able to do the testing.
And just do the rabies.
Program population, it's I picked like low-income households who are eligible for affordable internet connectivity, and who live in area code 95062, which is Live Oak area. So this is the first step, selecting the population which we're going to carry the test on, or the improvement. And this is the data. I had some data from an affordable connectivity program that was collected. Why I selected this area is that I had some data, like 40% of all county, Santa Cruz County households are eligible for affordable connectivity program. But in this area, this zip code, out of the eligible households, we were 24% of all the households, but only 29% of those eligible households signed up for the affordable internet program. So for this was kind of the reason behind that. The next thing I needed to do is kind of analyze, which is the factors, like what might be causing that. There was, of course, I conducted some sessions with the community, with other analysts in the county too, and identified those factors, which is like here, what might be helping improve the enrollment, and what might be causing it to kind of to be like less than other areas in the county. So these are just going to go over like language barrier. Is it the language barrier, unawareness, lack in outreach? Is it a complex process? Because I went through the process, and yes, it wasn't like straightforward. You have to have an application, and you have to know this and that. It's not like a straightforward. Lack of collaboration with county departments, lack of strong directive from the county, distrust in the program, or discontinuity on the program. So among all these factors that I believed after the analysis, these might be hindering the improvement in enrollment. I picked the lack of collaboration with county departments. I wanted to focus on this because it was kind of, I work for the county, and I know like some departments work directly with the community. So I picked that factor for my work. And the next step for my small desert change, I selected this factor to see if I tackle this factor, if I change it, maybe I can improve the enrollment. I selected Human Services Department because I wanted to leverage their work. They work closely with the community, and especially with the benefits unit. They work with Medi-Cal and CalFresh clients, and those clients are eligible for the affordable connectivity program. So I wanted to leverage their good relationship with the clients to see if they can do the outreach and inform them about the program to see if they can enroll. And then, of course, to carry this test, I need to collect the data on enrollment just to measure to see, okay, if we do the outreach, is it going to improve the outcome? And this would be like a small improvement. So next, this is the PDSA. Again, the goal is the improvement in the enrollment. Like, is it increasing? The population, we said it's this zip code or this area. And for the planning phase, this will be kind of the iterative like cycle of PDSA. In order to improve the outcome, what should we do? Okay, I know I need to improve it. I need to work with HSD, but it requires some planning. The planning is to get HSD to get them on board with this plan. To have California Emerging Technology Fund, who have the call center for enrolling households with affordable plans, to have them on board, to connect them with the Human Service Department, and also to have a plan for kind of having the data on enrollment, and also with internet service providers, because they have the data too when somebody enrolls in their affordable internet connectivity program. So this is all kind of plan. The do is the actual doing, which is, yes, I plan to do this and that, but how can I carry this plan out? It's like meetings, checking in progress, announcement on county website, and collecting the data. And the data will be like the response rate when somebody sees for HSD, they were sending flyers throughout their outreach to their client about their programs like Medi-Cal and CalFresh. They have like monthly packets that they sent to the clients. And with these packets, they were sending information about affordable connectivity program. So this was kind of what they mainly did. And then we're waiting, we're collecting the data, like, okay, is this helping? Are people more aware that are eligible? Are they more aware? Are they calling the number that we sent them? Are they enrolling in these affordable programs? And then, so the plan, and then the study is basically, okay, the responses. We're studying the data. Well, what's happening? Is it comparing it before the enrollment, let's say, in the whole zip code, it's like, 200 households. Is it getting better every month? And then the act is, depending on the results, should we continue this outreach? I selected just collaboration with county departments. Is this helping? Do we see improvement? And if yes, we continue it. If no, should we adjust it? Like, we were doing it through flyers. Should we do it through text, for example, to the clients, link to the application? And then if the response or the result is negligent, it's not worth the effort, then we just drop it. So that's basically what we did for a few months. There was some improvement. It wasn't like big enough or small enough to go either way. So HSD decided to continue it for a few months, and then we're gonna revisit again, look at the results, and then decide from there. So that's basically kind of the core of what we did for this small test of change or improvement. So for the takeaways, key takeaways from this tool is to, before you start it, it's like, we need to have a problem, or we need to have a goal for improvement. It doesn't have to be problem as long as we identify that something may be better to change, to improve. And then focus on one factor that we see that, okay, this, if we change this, if we improve it, it might have a good effect on the results. Do the PDSA, which is testing small, learning fast. It doesn't have to take months. Like in my example, sometimes it's only like a few weeks, and you can see if it's a good impact or not. And then do it again, with another factor or with the same factor with improvement. So that's mainly it. And if you have any questions, any comments before we go to the breakout sessions. Anyone have any questions?